at the TSH during the second trimester, 2.2% of the women had a slightly elevated TSH, but the rate of fetal death was fourfold higher in the women with a slightly elevated TSH. And again, these women need to be treated before they're pregnant to get the best results. In this study, 4,000 pregnant women were looked at 9 weeks of pregnancy. They were negative for thyroid antibodies, and they all had a normal TSH. But you can see the spontaneous abortion rate was almost twofold higher in women with a slightly higher TSH. Remember, these were in the normal range. So having a TSH in the upper normal range almost doubled the miscarriage rate. Again, you can't rely just on a TSH. I try and teach doctors we're not treating TSH patients, we're treating patients. And they need to be considered them more than just their TSH levels. Now, it's not just abortion and heart disease that's a problem, it's weight gain. In this study, women increased by 2.3 kilograms, which is about 4.5 pounds for every 1 unit increment in TSH concentration within the normal range. Men increased their weight by about 2 pounds for every 1 unit increment in TSH concentrations. And the author summarized the study by saying the change in serum TSH concentrations over time within the reference range was strongly and linearly associated with weight gain. 4-year-old children were looked at, TSH level and neurobehavioral changes. A high normal TSH, greater than the 75th percentile, was negatively associated with memory and verbal and quantitative skills. It was positively associated with hyperactivity and impulsivity symptoms. And a TSH greater than 2.2 presented with lower neurodevelopmental scores, as well as a higher risk of attention and impulsivity hyperactivity symptoms. And again, this is why I think it's so important to treat women for hypothyroidism before they're pregnant, so the kids don't develop ADD when they get older. This epidemic of ADD can be prevented. It's a nutritional and hormonal imbalance. It's not a drug deficiency syndrome, and hypothyroidism has a direct play in this epidemic of ADD. Now, Alzheimer's disease is also related to thyroid function. In this study, 209 participants, 12.7 years of follow-up, women with the lowest and the highest serum TSH concentrations had increased risk of Alzheimer's disease compared to those in the middle quartile, from 0.5 to 2.1. In the lowest tertile, a 239% increase, and the highest, a 215% increase. Alzheimer's disease, another epidemic disease right now, and it's a hormonal and nutritional imbalance syndrome that's not going to be treated correctly with drugs. It needs to be treated with a holistic approach, and one of those approaches is to balance the thyroid. Now, if you're diagnosed with a thyroid problem, you're confronted with what kind of thyroid medication to take. The conventional way to treat thyroid medications is to use levothyroxine sodium, Synthroid and Levothyroid. That's that T4 on this slide. However, many people need more than just T4 to get their thyroid to work correctly. Desiccated thyroid is what I use in my practice on a lot of patients, and that's a natural porcine-derived thyroid. It has T4, but it also has other thyroid hormone like T3, T2, and T1. It has calcitonin, selenium, it has a diuretic effect. And most importantly, for many patients who are nutritionally depleted or have been suffering from a long time, they need the desiccated thyroid over the levothyroxine sodium products. Now, when you take thyroid hormone, you got to be careful what you take with it. If you take iron pills, which is like ferrous sulfate, it can bind the thyroid hormone. Aluminum-containing antacids can bind thyroid hormone. Medications like raloxifene and bile acid sequestrants, as well as calcium pills and proton pump inhibitors, can also block the absorption of thyroid hormone. Those should be taken away from thyroid medication. I tell my patients to take thyroid hormone in the morning on an empty stomach and wait at least an hour before any medications come in. Now, there's other thyroid hormone choices. The desiccated thyroid choices include Nature Thyroid and Westthyroid. These are corn-free desiccated thyroid hormone from natural sources. There's compounded desiccated thyroid hormone where you don't have any fillers and you can adjust the dosages very tightly. Compounded T3, there's many different choices out there for patients suffering from thyroid problems. And a doctor skilled in diagnosing and treating thyroid problems can help you navigate these pathways. When I start with thyroid treatment, I start low. For adults, I'll start at 1/2 grain of desiccated thyroid hormone and titrate their dose depending on their symptoms and their lab tests and seeing them back. For those who are elderly or heart disease history, I start smaller and go slower. But all the while, I monitor patients' basal temperatures, lab work, physical exam signs, and symptoms. That's a holistic way to treat someone for a problem that can affect every single cell in the body. Now, I'd like to show you some pictures of some patients and their response to thyroid treatment. First picture I'll show you is Carol. Carol was 30 years old here. She was a school teacher working full-time, was playing tennis 5 to 7 days a week, working out, in good shape, feeling good, became pregnant, and around 3 to 4 weeks of pregnancy started to not feel well and gain a lot of weight. By her 5th month of pregnancy, she was put on bed rest due to abnormal weight gain and her blood pressure was going up. Carol gained 100 pounds during her pregnancy. In this picture was a picture of Carol 6 months after she delivered. At this point, Carol was unable to take care of her newborn baby. Her husband, Todd, was having to stay home and take care of the baby with her. She didn't feel good. She couldn't go back to work. She was tired all the time. Carol was eating a good diet. Carol was taking nutritional supplements. And when she came to me, I was struck by her appearance and how hypothyroid she looked. What I was looking at was her eyes were almost swollen shut because she has so much fluid in her face, and she had lost her hair on the front part of her forehead. Carol had normal thyroid blood tests. She had a basal body temperature that was 2 degrees below normal. And Carol met every sign and symptom to make the diagnosis of low thyroid. She was tired, she was cold, she was constipated, her hair was falling out, she had dry skin, and many other symptoms. I elected to give Carol a therapeutic trial of thyroid hormone. And here's a picture of Carol 6 months later. Now you can certainly see she lost the weight in her face, and her hair became back to life. More importantly, she began to feel better, was able to take care of the baby, went back to playing tennis 5 to 7 days a week, and was feeling her normal self. And this is one response of a patient with a normal thyroid blood test. So in Carol's case, clearly the thyroid blood test did not pick up what was wrong with her. Here's another patient. His name is Alec. And this was Alec before I saw him, and I asked Mom to bring this picture of Alec to me. And clearly from this picture you can see that he's swollen under his eyes and he's puffy here. And Alec is about 6 months old in this picture. And this was Alec when I first saw him in the office. And when I walked in to see Alec in the office, I had the chart in one hand and I had my hand on the doorknob. And as I opened the door and saw him there, I paused at the opening. I didn't introduce myself to the parents because I was struck by his appearance. And I blurted out, "He's myxedemic." That was the first words that I said to the parents. And the mother said, "What's that mean?" And I said, "He's severely hypothyroid." And she said, "No, he's not." She's flipping through papers. And she gave me thyroid blood tests and said, "We just had his thyroid levels checked, they were normal." What I was struck with was that Alec was sitting in that wheelchair. His face was all puffy and swollen under his eyes, and his tongue was big and swollen and hanging out of his mouth to the side, and he was drooling. Alec also had puffiness on his wrists. Well, when I checked Alec out, he had very slow reflexes. He was constipated, he was cold, his skin was dry. Alec was also having seizure disorders from being a cerebral palsy baby, and he was on 3 seizure medications at high doses. Alec had normal thyroid blood tests, he had low basal body temperatures, he had many signs and symptoms to meet the diagnosis of low thyroid, and I elected to give him a therapeutic trial of thyroid hormone. And here's a picture of Alex 3 months later. And 3 months later, you can see that he loses the swelling under his eyes, his tongue receded back into his mouth, his hair came to life, and these are the responses that I see in my patients on a daily basis. Another important factor that happened with Alec was that his seizures went down markedly. He went from 3 seizure medications at high dose to 1 seizure medication at half dose. He went from having 20 to 30 seizures a week at full dose to having 1 to 3 mild seizures a week at this small dose of medications. And this is a picture of Alec before and after. This is a picture of Alec now. So again, here's another case of a patient with normal thyroid blood tests who clearly could meet every clinical sign to make the diagnosis of hypothyroidism. These are more than just TSH patients. This is Dawson. I was taking care of Dawson's mom for thyroid problems, and she wrote me this email, and I'd like to read it to you. "I thought you'd like to see Dawson's latest report card and comments. He used to be reserved and did not want to interact socially. He has been on Armour Thyroid for 6 weeks now, and the teacher has noticed that he has changed in personality and attentiveness. Maybe all the kids being diagnosed ADD and ADHD are really hypothyroid. I'm so thankful that he had help available to him. My mom commented on Easter that my kids were like 2 different children. I agree. Dawson could not sit at his chair at mealtime. He was up and down and up and down. It drove us crazy. Now he sits through the entire meal and eats. I've not heard that his stomach hurts, which used to be every night, since the first week he was on thyroid meds. I no longer worry about my babies. They are doing so well." Now, Dawson was doing fine on his thyroid hormone until I got another email from his mother saying all his symptoms were back. And in the email she said he didn't do well on a spelling test, and she knew he knew the words beforehand. And she emailed the spelling test to me. And here's Dawson's spelling test. And you can see that, well, he may have a doctor's handwriting, but it's all over the place. He's got some alien drawings down here, and he's missed a bunch of the words. Well, the mother said that he was up and down again, and his basal temperature had fallen again, and she thought he had reversed his symptoms. I asked her, is he in a growth spurt? And the mother said yes, his pants were short on him, and he was in the middle of a growth spurt. So we upped his thyroid medication a little bit, by 1/4 of a grain. The mother had asked the teacher 10 days later to repeat the spelling test because Dawson was doing much better and all his symptoms were better controlled. And here's what happens when you get the thyroid hormone correct. His spelling test 10 days later, without preparing with his mother for this, looked like this. And you can see his handwriting improved, there was no alien drawings, he got most of the words correct at that time. And this just shows the brain dysfunction that can occur when thyroid hormone is not normal. And for those of you suffering with thyroid function, I don't have to tell you that you're feeling brain fogged and fatigued and you can't think clearly. But again, there is a cure for this, and it's getting the thyroid gland corrected. This is a report card from Dawson's teacher saying how much better he was doing. So why do blood tests miss it in many patients? Well, this is these chapters I cover in my book, Thyroid Hormone Resistance and Poor T4 Converters. And here's the pathway again. The thyroid gland releases T4, T4 should convert to T3, and T3 should get into the cells and have the effects on the body. However, if there's a block between T3 and getting into the cells of the body, patients can have normal thyroid blood tests yet feel terrible. And that's why the blood tests can miss it. And that's what I see in the vast majority of my patients. This has been reported in literature since 1967. It can occur with adequate production of thyroid hormone. I say it's analogous to adult onset diabetes, where many of these patients produce enough insulin or sometimes too much insulin, yet they still have diabetes. In either case, the laboratory tests are inaccurate for thyroid problem, just as a laboratory test to check for insulin levels are inaccurate for diagnosing diabetes. Now, it's reported in literature from genetic anomalies of thyroid hormone receptors. You can also have autoimmune, oxidative, or toxic damage to thyroid hormone receptors, or competitive binding to thyroid hormone receptors by pollutants and food additives. The number 2 and 3 bullet points on this slide are really what's going on in patients today. One of these things that can block that is bisphenol A. It binds to thyroid hormone receptors. It's found in food containers and baby bottles and water bottles and metal food cans. It's a dental sealant, and it antagonizes thyroid hormone receptor activation. Over 6 billion pounds of BPA are produced and over 100 tons are released into the atmosphere worldwide annually. And of course, the United States is number 1 in BPA exposure. A study of 394 adults found that BPA was detected in 95% of urine samples. And PBDEs are another reason why thyroid hormone conversion doesn't take place correctly. It has a structure similar to thyroid hormone, and it can displace thyroid hormone from its binding protein. PBDE stands for polybrominated diphenyl ethers. It's widely used as flame retardants. It's in plastics and foams and building materials and carpets and upholstery. It's in bedding and furniture, computer equipment. It's detected in meat, fish, vegetables, and dairy products. It's in indoor air. It's in household dust. In one study, they found PBDEs in every sample of household dust checked. My experience with testing my patients is that 100% of them have shown laboratory signs of bromine toxicity. And that's part of these PBDEs. There's increasing concentrations of PBDEs found in breast milk, and serum and human tissue samples over the past 30 years in Europe and the US have been increasing. So these polybrominated diphenyl ethers are found in over 97% of US residents. The levels are 20-fold higher in the US than in Europe. 270 pregnant women were studied in California. Their levels of PBDEs were similar to the national average. What the authors found was that TSH declined 16% for every 10-fold increase of PBDEs, and for every 10-fold increase of PBDEs, subclinical hyperthyroidism doubled. Bromine toxicity is an epidemic problem. 100% of patients that I've tested for bromine levels have tested toxic. In talking to practitioners across the country, they are seeing the same results that I'm seeing. The way you can get bromine out of the body is to ensure adequate iodine levels and to ensure adequate thyroid hormone levels. Sunscreen can also present problems with the thyroid. 4-MBC and OMC decreases 5'-deiodinase activity. That's the enzyme that converts thyroid hormone from inactive thyroid hormone T4 to T3. It's been found in wastewater treatment plants across the United States, and there's a bioaccumulation of these products in fish and in human milk. Now, I tell my patients not to use sunscreen, to use appropriate care, and not get burned in the sun and to cover up. It's much healthier than using sunscreen. Again, this is the pathway that we want to emphasize and to normalize. when I'm lecturing to physicians, I'm showing this pathway over and over in my lecture, saying this is what you want to focus on. Now you can also have a T4 conversion block. So in this pathway, you can see the thyroid produces enough T4, yet some, most, or all of T4 is not converted into T3, and most importantly, patients don't feel well. They have symptoms of hypothyroidism. In this case, the TSH will be normal, yet they will still have symptoms of hypothyroidism. This has been reported in the medical literature, and here's one study of lowered T3 levels in the elderly associated with lowered attention, depression, increased mortality, and lowered ability to perform activities of daily living. Again, in this study, they had normal TSH levels. Now, thyroid hormone levels in cardiac tissue and iodine deficiency were looked at. Iodine deficiency in rats resulted in a subclinical hypothyroid picture, a slightly elevated TSH, but normal T4 and T3. And despite normal T3 levels, cardiac tissue was found to be deficient in T3. T4 therapy, that's Synthroid or Levothyroid, was unable to correct the cardiac deficiency in the presence of iodine deficiency. What the authors are saying is, it's not just thyroid hormone that needs to be treated in hypothyroidism in many patients. You need to treat the underlying cause of this, which in many cases is iodine deficiency. My book, Iodine, Why You Need It, Why You Can't Live Without It, goes into this in much more detail. Nitrates are contaminants of drinking water. They're found in nitrogen fertilizers that people are putting on their lawns to green up their lawns, and high levels are found in green leafy and root vegetables. Organic lettuce is found to have less nitrate as compared to conventional lettuce. Compared to women in the lowest quartile of nitrate intake from public water supplies, those in the highest quartile were found to have a 2.2-fold increase risk of thyroid cancer. Compared to women from the lowest quartile of nitrate ingestion from food sources to the highest quartile, there was a 2.9-fold increase of thyroid cancer. So when treating someone with hypothyroidism, it's important to take into account other things like iodine deficiency and toxicity, like nitrate toxicity, and to really use a holistic approach. That's the best way to improve a condition that can affect every single cell in the body. Now, there are other things that can inhibit T4 to T3 conversion, and on these next two slides, I'll show you them. There are nutrient deficiencies like iodine deficiency, iron deficiency, selenium, zinc, vitamins like vitamin A and the B vitamins can also inhibit that conversion when they're deficient. Many medications can inhibit that conversion, such as amiodarone, beta blockers, birth control pills. I've treated many women over the years for symptoms of hypothyroidism by simply having them get off their birth control pills and correcting the nutrient deficiencies that birth controls cause, and their hypothyroid symptoms magically go away. Iodinated contrast agents can inhibit T4 to T3 conversion, lithium in pharmacologic doses, medications like methimazole, dilantin, propylthiouracil, SSRIs, the antidepressant drugs, can inhibit that conversion, theophylline's an old asthma medication. The aging process slows that conversion down. Alcohol in excess can block that conversion. One study showed alpha-lipoic acid inhibiting that conversion. Now, I use a lot of alpha-lipoic acid in my practice. I've only seen one patient in 20 years where they were blocked from T4 to T3 conversion. BPA, as I mentioned before, is inhibits that conversion. Chemotherapy can block it down. Cigarette smoke by producing thiocyanide, which inhibits iodine uptake. Cruciferous vegetables like cabbage and cauliflower can inhibit that conversion. Diabetes, the fasting state, and fluoride in our water supply can also inhibit it. Hormones can also inhibit it when they're deficient, such as growth hormone deficiency. Hemochromatosis or elevated iron levels. Lead, a low adrenal state. Mercury, pesticides, soy use can inhibit it, as well as excess stress. And the process of stress from surgery can inhibit that conversion, as well as radiation. Now, soy can cause many thyroid problems. And in regards to soy protein and soy isoflavones, they reduce T4 absorption, they block the conversion of T4 to T3, and they can cause autoimmune thyroid disorders. So in this study, they looked at a hypothesis: is there a difference in the development of autoimmune thyroid disorders in infants fed soy versus breast milk? In a retrospective analysis of 59 autoimmune thyroid children compared to their 76 healthy siblings and 54 non-related control children, those fed soy were much higher. The autoimmune thyroid children went 31% compared to their healthy siblings of 12%, and non-related control children 13%. And the authors summarize it by saying this analysis documents the association of soy formula feedings in infancy and autoimmune thyroid disease. Soy should be avoided by all infants. There should be no soy formula fed to boys or girls. And in fact, unfermented soy should be avoided by all of us. It's a Not true that soy is a health food. Soy is a dangerous food for the body. It causes thyroid problems, it causes autoimmune thyroid problems, and it causes mineral and vitamin deficiencies. Isoflavones inhibit TPO catalyzed iodination. What that means, that's a reaction that occurs in the thyroid gland to produce thyroid hormone. These are commonly found in over-the-counter supplements that contain daidzein and genistein. This inhibits the intracellular thyroid hormone production. They're found in soy products, including peas and beans and nuts and grain products, including coffee and tea. There's an average of 3.1 milligram dietary isoflavones consumed by 35% of the US adults daily, and adolescents diagnosed with Graves or Hashimoto's are more likely to be fed soy formula as infants. There are other T4 to T3 inhibitors. I'll just comment on one of them. It's vitamin A. I diagnose vitamin A deficiency in a vast majority of my patients. And vitamin A modulates thyroid gland metabolism, peripheral metabolism of thyroid hormone, and the production of TSH by the pituitary. The sources of vitamin A are in liver, eggs, and dairy products. They're the most bioavailable source. Plant-based carotenoids provide a poor source of vitamin A. So if you're just going to eat a vegetarian diet, they are not the greatest sources of vitamin A. Now, vitamin A deficiency is a leading cause of worldwide childhood blindness. It can cause severe and minor infections and thyroid disorders, hyperthyroidism, autoimmune thyroid disease, and possibly thyroid cancer. Worldwide, there are over 127 million preschool children and 7.2 million pregnant women who are vitamin A deficient. Part of any holistic workup should include vitamin A levels. Now, vitamin A deficiency has been shown to cause thyroid hypertrophy or swelling of the thyroid. It reduces thyroidal iodine uptake, and it impairs the synthesis of thyroglobulin and the coupling of iodine molecules to form thyroid hormone. And it's also been shown to decrease the conversion to active thyroid hormone. Now, iodine deficiency can also cause a decreased T4 to T3 conversion, and I cover that more in my iodine book. But anyone with a thyroid problem deserves their iodine status fully evaluated. So I'd like to leave you with a quote from Linus Pauling. He said, "Never put your trust in anything but your own intellect. Always think for yourself." I hope I've left you with the ability to think for yourself and to not be considered just a TSH test. Now you are armed with the knowledge that you can go to your doctor and help him make the right diagnosis for you and the right treatment for you. Don't give up if you're not feeling well. There are treatments available for you. Thank you for listening.